So, sadly, Gardner Harris, who was going to moderate this session at the last minute, wasn't able to join us. So I'm pinch hitting for Gardner. And Mac, thank you for staying online. You can see, I guess, the panel participants. No, you can't.
I can't see you all at this point.
Okay. Well, we can see you, and we can hear you. So let me start by first asking, there were a number of questions that people had for specific speakers this morning that we weren't able to get to. So let's start off with them. And Veronica, you're first up.
Thank you very much. Very fascinating presentations from a variety of settings. Some questions I have around the examples that were given by Professor Santos Burgos on the evidence that exists on the impact of strengthening regulatory authorities. And I saw that you cited a paper that you have been working on, and it seemed to have been submitted. Has this also been made available to the committee? And the reason why I'm asking is we are looking very specifically at things that you have pointed out as gaps in our knowledge, which is developing better methods to measure impact. And I was wondering if you can elaborate a little bit more on your methodology that you have used and why you still think there are gaps in methods to assess it. And I'm thinking that's very much related to a paper that we heard from McLumpkin cited, which is a paper on the strengthening of the regulatory authority in Mexico, for which it was made the case that this that had an impact on trade. But I was wondering if you could elaborate a bit more on what methodologies can be used and where are exactly the gaps that we would need to address, or this committee should potentially make recommendations about. Thank you.
Yeah, go ahead.
Well, thank you very much. No, I have not made available the paper. It's being submitted. But certainly, as you saw one graph that showed the line relationship and then the conception model. Basically, the paper addresses the conceptual model where trade is included, the democratic processes within countries is included, the social participation for that, and then the capacity of the institutions on how to regulate, in this case, NCDs, risk factors, how they perform, and eventually their impact, and not only their impact on health, but eventually what is the impact on development. Interestingly, I can say that the impact on development is not direct, but it is indirect through improving labor productivity, and that is a very interesting factor. There are tons of gaps of information. All of this is based on secondary data analysis, and there is. We tried to do it for the 35 countries in the region, and we ended up doing it for eventually only for 17 countries. There are lots of missing data in the Caribbean, and there are lots of incomplete data in other areas. How the participatory process is happening within the regulatory process, in the risk assessment and the decision on doing on what regulatory options are chosen, and then on the implementation of the regulations. That is really a missing part. There is almost nothing known on that part. So I would say that is that is in terms of missing information. All of that was done through generalized linear models. So you have a set of generalized linear models for each one of these components of the overall scheme. So I don't know if I fulfill your complicated question, but
would it be possible to share that for the consideration of the Commission?
I think that if you don't publish it, yes.
Great. Jono, I think you were next up.
Just to echo what Veronica said, this is a fabulous set of presentations. And while we're on the point of sharing, I hope all of you will sign whatever you have to sign to leave your PowerPoints if you want to pull out any proprietary stuff. But it's a real resource, and just because of the quality of examples and structures, and really useful. Two questions. One for Barbara. I think almost everybody, or a lot of the speakers that we heard here and then in Costa Rica talked about risk-based approaches. But when pushed, it wasn't clear that they actually were doing it, or whether it was kind of the pixie dust of aspiration. And can you, since the 2010 report where you really laid out kind of how to do it, what's your sense of the uptake? And if you could suggest 3 things that you think would be good ideas to get countries to really apply it more in their decision making, that would be helpful. And then just to, so it's all on the table. For a question for Mac, it's been fabulous to see how the cobbled solution to generic AIDS drugs in 2001 that created a pre-qualification has blossomed into such an effort. I've heard it described as WHO becoming a super regulator. Its success is built on the fact that it's got 36 regulatory authorities working with it. But if you look at the benefits and the streamlining and all, is that nobody has ever talked about WHO as a, quote, super regulator in this field. It's something people resist, but I'd be interested in any thoughts about whether this is a role that could be part of the overall way of getting right leveling different regulatory functions.
So, Mac, we'll give you a minute to think about that while Barb gets to address this. What's been the uptake on the risk-based approach?
Yeah. So thank you for the question. So it's a good question. Julie asked me the same question at lunch. So I think, I've been working in food safety for 18 years, and I have seen a lot of movement around food safety and around the risk-based approach. I think one of the challenges is that, tackling food safety, particularly when you're not tackling it yet, is overwhelming. And where do you start? Here in the U.S., I think there's been a lot of movement. The passage of the Food Safety Modernization Act helped. But even so, with FDA is still struggling with how do you implement a risk-based food safety system. So this is not an easy task. And that's why I think it's important to realize that when I had the graphic up of what is a risk-based food safety system, the committee designed it as a circle. And we designed it as a circle for a reason, because it is about continuous process improvement. Okay. And so, I think the uptake is there. I think a lot of people are struggling with what does it mean. I think a lot of countries don't have the resources, human resources mainly, to do a risk-based system, you need to have people that understand the system and can apply systems-based approaches. It means you have to have collaboratives and transdisciplinary, multidisciplinary groups of people to working together, but you also need economists and risk assessors and statisticians and epidemiologists that know food safety. And I will say, from my perspective, there's not a whole lot of us out there. We run into the same people meeting after meeting after meeting. So one of the goals is to build capacity, and I think that will help. So you asked me to identify 3 things that I would recommend. One is you have to start somewhere. And, that's, I think, the biggest hurdle. And what we heard from FAO when we started on our project was countries, they just didn't know where to start. And it's, when I talk to my students too, it's like when you stare at a blank page, it's hard to know where to begin. So picking something and starting somewhere. And I think one of the opportunities that we have in low and middle income countries is they don't have systems that are already in place that people are invested in. So I think one of the challenges with USDA and FDA here in the US is, you're also battling culture and history. These agencies have done it this way for a really long time, and you're coming in and you're starting something new. There's that opportunity. It also means that there's a long climb. And so one of the things that one of the other things that I would advise people to think about is like we're going into Ethiopia, we're not going to climb the mountain in 4 years. We're going to take a couple steps, and hopefully that'll lead to better things down the road. This is something that came up earlier that I, just in my own experience here in the U.S., is really quantifying that return on investment. And that's not something that scientists like to talk about, in my experience. But quantifying the return on investment for food safety is difficult because we're talking about prevention. But I'll give an example that I think it's wise to consider in any, not just food safety, but any public health-oriented field. Here in the United States, we have a pretty good foodborne disease surveillance system. It's called PulseNet, and there's a subsystem called FoodNet. FoodNet is does active surveillance in 10 Sentinel sites around the country, and PulseNet is a molecular surveillance system. CDC, up until a few years ago, got $25 million a year was their budget for food safety, for foodborne disease efforts. Half of that was required to go to the states. So the budget for foodborne disease at CDC was $12.5 million, and the other $12.5 million went out to all the states and territories. And I can tell you, just talking to the states, I'm not going to say all, but the majority of states that I hear of, all of their food safety activities are funded by CDC's ELC grants. Okay, so $25 million a year got put into food safety at CDC. Rob Scharf, who's at Ohio State, and Craig Hedberg at the University of Minnesota actually did a cost-benefit analysis on the return on investment in PulseNet. And they looked at the benefit of PulseNet in 2010 and how many illnesses it prevented due to 3 pathogens. I think it was Campylobacter, Salmonella, and STEC. Now, this is just a subset of all the foodborne pathogens. 3 pathogens in 2010. I think the return on investment was $100 million. And so, or about that, per year for 3 pathogens. Okay, so now they're investing about $50 million in CDC in their foodborne disease, in their foodborne group. You're still getting a huge return on investment for the surveillance that we're doing. And I thought that was really impactful. And I also do a lot of work with policymakers. When you go in and you start talking to policymakers about budgets and things, and to be able to have that kind of evidence to back up and say, this is worth the investment. And this is even a conservative estimate because they didn't include long-term health outcomes. They didn't include the cost to public health agencies. There was lots of things that they didn't include in their estimates. And so I think my second piece of advice would be, how do we better quantify the return on investment for policymakers in the industry? And of course, the third thing is investing in data. I'm a data person, so I'm going to be a little biased here, but investing in data initiatives. And sometimes a lot of times you start with secondary data analysis, and there's a lot you can do with secondary data that we could be mining. One of the challenges we have is getting access to that data. And so figuring out ways that we can leverage the existing public and private data sources to inform decision making might be a better approach than trying to reinvent the wheel and develop data from scratch. So I'll stop there.
Good. Mac, you've got the question, is WHO becoming a super regulator? What do you think?
Well, I've never heard it described that way, but I would say that, as Jono pointed out, it now today is an integral, unique, critical part of the global regulatory ecosystem. And I say that because it performs a lot of different roles, and those roles have expanded over the past 20 years for a variety of reasons. As Jono pointed out, the whole PQ piece of it started in the late 1980s with vaccines, and then in the early 2000s with the HIV/AIDS epidemic. The medicines piece came in looking at HIV products, and the whole purpose at that point in time was simply to help the UN procurers know which manufacturers, and particularly those manufacturers from emerging markets who were then producing much more affordable versions of the HIV products, which ones were not only producing affordable versions, but quality versions, so that the UN procurers knew from whom to purchase the products when they were buying them for use in many of these national HIV/AIDS programs. Well, since that time, obviously the scope of the products has gone from HIV to malaria to TB to human reproduction to many of the NTDs, and it's gone from vaccines and medicines now to diagnostics, and most recently into vector control products. What's interesting on the scope issue is that with the WHO's new interest in non-communicable diseases, the question has been raised, does the scope of the products that are eligible for PQ need to be expanded, and if so, how? Because if you think about the essential medicines list that WHO publishes, currently only about 10% of the products that are on that list are even eligible to go through PQ. So when you start thinking about hypertension drugs and cancer drugs and diabetes drugs and antimicrobials, all of those are not currently eligible to go to PQ. And the question I think has rightly been asked, how can you have a quality healthcare system if you can't have quality cancer drugs and diabetes drugs and hypertension drugs, et cetera, et cetera? So the question is, how would you prioritize these products in thinking about the scope that you would bring in? The other thing that has fundamentally changed the PQ program is it is fundamentally not now just a program to help the UN procurers and the large multinational procurers. When you look at the large number of level 1 and level 2 agencies around the world, these are agencies through a series of programs, including the WHO collaborative process, the PQ collaborative process, that they really depend on the work products. They depend on the scientific assessments. They depend on the inspections that WHO PQ does in order to inform their own decisions. So they really serve two different and distinct purposes here. And beyond that, PQ really only focuses on the marketing assessment, the marketing decision assessment. But WHO and that larger regulatory health technologies unit at WHO, of which PQ is part, are also involved upstream in programs to help countries look at the oversight of clinical trials. And they're also involved downstream in helping countries look at pharmacovigilance and look at supply chain, supply vigilance in their countries. And the newest thing that I'll finish with, and this might tell you why some people are looking at all of the various aspects that WHO does is this new global benchmarking tool. And personally, I think this is going to be one of the most definitive things going forward, because this is a tool that they have developed in consultation with regulatory authorities around the world over the last 5 or 6 years that actually has a series of hundreds of indicators for every module, whether it's regulated oversight of clinical trials, whether it's GMP, whether it's pharmacovigilance, whether it's generic drug assessment, whether it's new drug assessment. And it says if you have certain indicators, if you can show you are capable at certain indicators, you can be assigned a maturity level between 1, which is basically you turn the lights on, to 4, which in WHO parlance, 4 means you are a agency which is performing at the top, and you have consistently done that for a while. And it is an agency upon which WHO PQ will rely if a product has been through that agency, and then the product comes to be PQ. WHO will not repeat the inspection, it will not repeat the scientific assessment, but it will rely on that, just like the countries downstream rely on WHO when they do a full assessment for products that haven't been through a level 4. So all that to say why I think they really are this very unique, integral part of the regulatory ecosystem.
Thank you. I think, Jillian, your card was the next one up.
I'll try, excuse me, I'll try to keep this brief. But Dr. Santos, I was just wondering, one of the points that you talked about on the phone with me, I was hoping you could maybe share with the big group. And just to summarize, you were saying that we were talking about the financing these agencies, and you said that, these businesses, they need market authorization, they need license, they need to be inspected in order to sell product. And when you subsidize those services with tax money, you're kind of using tax dollars to subsidize the profits of these companies. And I remember I said, well, what do you say to the argument that when you run the agency totally off user fees, you kind of direct the attention of the people in charge towards those services that bring in the user fees only, maybe to the neglect of some of the other services? And I was wondering if you could just share your thoughts on that question with the whole group. Do you remember our conversation? Yeah.
I do remember our conversation about that, and I think that's critical, because it might lead to a bias on where do you actually do your work, and basically the issue is, first, where are you going to use your tax money, given that everybody has mentioned that there are limited resources, governmental resources to do regulations. So everybody knows that, everybody acknowledges that, and that is the biggest limitation. So the first answer is we have to assure that what is common goods, those have to be financed by tax money, and that is available for everybody. Everything else that is for private benefit should be paid by the regulated sector. Now, here the issue is, okay, so only those who can pay will be able to. That's the question. Only those who can pay will get the attention from the regulatory agency. And here the thing is yes, we have to handle the financial flows in such a way that under several principles. One of the principles has to be that regulation have to lead towards equity. That means also those who are entering the market that might not be strong financially to enter, for example, a restaurant or somebody who handles food, who is starting. That might be a huge entry barrier for them if we charge that unit, that establishment, a large amount. So maybe you want to make an explicit policy that entity will have a lower fee or even exempt a fee, but that would be an explicit subsidy, temporary subsidy, while this unit increases. The same thing happens with any national industry versus an international corporation. You might do exactly the same thing. As a transitory process under the solidarity principle, you would say, okay, I would use part of the resources that I get from everybody else to work with this other regulated agency to allow him or her to get into the process. For me, the key here should be the assessment of the regulatory process itself. So I might have a little concern when you don't have at the end of the process an evaluation of the impact of your regulation. If you just regulate a segment of the economy and not everybody, then you will not reach your public health goals. So you do need to have public health goals attached to your regulatory policies and processes. If you want to reach that, then that justifies the use of differential fees eventually, but explicitly having them as temporary subsidies.
Javier, do you want to opine from the experience that INVIMA had in developing the financial model? And I guess you've got a follow-up question? Yeah. Thank you.
I think it is an interesting question. The first point is, if you talk about pressure from the private sector, from the manufacturers, and whether that is higher or lower depending on whether they pay or not, I think it's the same. I think it's the same regardless of payment. And I think it's the same because regardless of what you do as a regulator, you will always have the pressure from stakeholders like the Ministry of Trade, stakeholders like the trade organizations to do less, to protect the local industry, to be efficient. Sometimes it's a good pressure because it makes you be more efficient. So I don't think the pressure will disappear if we get a tax-based financing model. The pressure will always be there. The second point, and sometimes the pressure comes from money, but it comes from the money paid into the election campaign. So you might get rid of the tax of the user fees, but if they support the winning candidate, then the pressure will be much bigger than if we were paying just the day-to-day fees. The second point is about checks and balances. If you do have a good governance structure in place, and the fee is a fee that is not earmarked to do specific activities. It's a fee that is basically, it goes to a pool for the decision makers to set priorities, and the governance is such that the priorities are done in a transparent manner, and that you engage not only the industry but also the society overall, civil society groups, other governmental organizations. I mean, that basically, those checks and balances will protect the agency in terms of not being influenced by the industry in such a way. But I think I just don't believe a task-based financing system is sustainable or positive or reliable. And I might be talking from my own experience. The National Institute of Health. So we have two big institutions in the country. So National Institute of Health and the regulatory agency, similar to the NIH and the FDA here. They don't charge anything. They just basically totally tax-based. And they have a third of the funding we have, a third. And every year, regardless of Zika, regardless of chikungunya, regardless of food outbreaks, every year they have to convince the policymakers and the politicians of the importance of having such an institute. So I think de facto, an automatic, pragmatic way of funding these agencies is, I think, a better way to go. Of course, having in mind that the checks and balances and the governance structure needs to be in place to avoid having an instrument that could be, just not a health authority, but an authority, kind of like an arm from the Ministry of Trade.
One follow-up, if it's directly relevant to this. Yeah? Okay. And then we'll go back.
Okay, thank you very much, Madam Chair, for the opportunity to pose this question. It's a follow-on question to a question that was posed to Mark Lumpkin, and then I have one for Barbara. So, Matt, on the issue of WHO pre-qualification, there is no question that it had raised the standard in environments where the regulatory systems have been weak and have not been strong, and also had provided the opportunity to educate manufacturers' products that are made in those environments and hence make them suitable for procurement. The following question I have is really, how do we reduce dependence on WHO to be conducting these roles? Because we know that WHO naturally is a normative institution, it's not an implementer. And if I recall properly, there were really two key objectives or reasons why this program was established in the late 80s to early 91, Mark, that you mentioned, was to provide a means for UN to procure drugs from those environments with weak regulatory systems. But the second objective was to ultimately transition the role of proper, robust regulation to the national institutions that have the constitutional mandate to do that. I am afraid that the path towards this transition, wherein these national authorities are now taking over, has been very slow. And so you start to ask the question, how can we quickly increase the pace of this transition? And with the initiatives such as the global benchmarking tools that have been developed, etc., I think donors should really pay attention now to helping these national institutions to achieve the highest levels possible by not just continuing to support PQ to do these activities that really ultimately is not their role at the end of the day, but to now help these agencies, national agencies, to achieve the milestones that have been established in the GBT. So I think that these are legitimate issues around pre-qualification. Folks are concerned and afraid that this will be an ad nauseum activity by WHO, but ultimately it was meant to help also transition to national authorities. And quick question for Barbara. Barbara, I was surprised to see that in the frameworks that you are developing in the research project in Ethiopia, I did not see mention of the Ethiopian regulatory body, the Food, Medicines and Healthcare Authority, because as you rightly said, part of your aim was also to build capacity. And this body has the constitutional mandate to conduct surveillance for food issues, etc. So I was surprised that they were not part of your partner list. Thank you very much.
FAMACA is part of it, but they're not a key partner in the funding, but they're going to be heavily involved in the risk ranking and prioritization process. But they're not formally a partner on the project, but we are engaged with them.
Okay, Claire, I think your flag was the next one up.
So my question is going to be directed at Javier, and I was very impressed and have been impressed what's happened in Colombia. One of the things that is really important when you move towards risk-based approaches is really having data to help support those types of analysis. And I was in Colombia several years ago doing trainings on risk ranking and such associated with some trade issues. And one of the things that was a challenge was access to data, a lot of the analysts there. And I'm curious to how you went about changing how you collected data and making it available, and what were some of the challenges that you faced in doing that?
Thank you. First, I just want to comment on your question. I think the global benchmarking tool is, as we just heard, is a very important milestone. Not just because it will assess countries, and countries will aspire to have good results. That is an amazing big driving force, but also because of something that is not very well known or commented, the importance of having institutional development plans. Because that basically is the key for the regulator to be on the driver's seat. Unless you, regulator, puts together the institutional development plan, we funding agency will not give you a penny, or we, government, will not give you a penny. And that's the way we will measure you, that's the way we will see whether you've succeeded or not. That is key, because it's the coordinating tool and the tool to guarantee sustainability in the right direction. Just a comment on that. And in terms of your question, data has been difficult to get, but sometimes it's all about the prerequisites to be able to have appropriate data systems in place. And I'll give you an example. When we were trying to have the risk management system to reduce the inspections at the port of entry for food, we asked everyone, what is the best way to classify the different food imports? I mean, a way that is not too aggregated, that is not disaggregated. I still don't have a good answer. We got answers like, customs data. And always this big push to align your system with the customs system. Others said, go to Codex. Others said, we have our own. In the end, those prerequisites are so important that could actually be the bottleneck to be able to go beyond. So in the end, we decided to go with our own coding. That is a problem because we cannot align with other countries because it is just national based. So that's the first point. The second point is, in terms of data, we did develop the systems to capture and analyze data ourselves. But it requires sustained funding, and it requires sustained support, which policymakers and manufacturers and everyone are not very happy with in terms of being patient or being able to provide, like the example I gave you for the Global Alliance for Trade Facilitation. They wanted results within a year. Of course, we were already, doing work for the previous 3. But I guess all I'm saying is the prerequisites are not there, and the sustainable support and funding is not there. So everything is there for it to fail. But then, I take this point, you need to start somewhere. And I guess a good push is the push to being transparent. Transparency has helped us a lot in terms of being able to be honest about what you have, what you don't have, naming and shaming. That creates demand for the data, because if the data is not useful or used well, nobody pushes for it.
I just want to say that this is one of the recommendations about data.
Microphone.
One of our recommendations out of the last report was about sharing data and having data that I don't think a lot of the countries have made much, or some have made progress on. So I think we should listen to this, and I thank you for your comments.
Unfortunately, I don't see how countries face similar situations, but there's no good platform to share conversations on the food side. On the medicines health side, PAHO plays a very interesting role, and you have that platform. But I don't recall actually attending or participating in any meeting or platform to discuss food issues with anybody in nearly 2.5 years that I was the head of the regulatory authority. So that might be something to think of.
Barb, you want to comment?
Yeah, I do. I mean, this is something that I'm very interested in, is how do we improve data sharing. In the United States, we do not do it very well. And I'm of the opinion one of the challenges that we face is, there's a lot of mistrust in this field, in this area. The producers don't really trust to get their data out there. It's considered proprietary. And I think your point that there needs to be a platform for having discussions about data governance. I mean, that's really where you have to start is, how are we going to pull this data together? How is it going to be shared? How is it going to be used? What sort of metadata do you need to make use of it? And even here in the U.S., we don't really have a platform to engage stakeholders in developing a data governance model that everyone's comfortable with. And I think that's where the discussion really needs to start.
Listra, next up with a question.
Thank you so much, Catherine. I appreciate the opportunity to ask a question. This morning in Dr. Santos's presentation, one of the things that he mentioned as he discussed public health regulatory institutions and their capacity, he mentioned that one of the challenges that was observed over time was the widespread nature of the informal sector and the large quantity of micro businesses. And as we listened further today, we heard from the presentation on Colombia that the impetus for developing a strong regulatory system really, in a sense, came from the trade aspects. But we also heard from the presentation earlier on Ethiopia, where the discussion was included about the FERG report that talked about the foodborne disease in Africa, but also even as we've listened this morning about the consequences, where you have the public health consequences and you have other wider economic consequences, and largely those are measured and can be measured by trade. My question is, as a committee, what should we recommend, and what are the things we need to be thinking of more in terms of support or recommendations for regulatory agencies? What should they consider when looking at their domestic economies and looking at issues related to public health, where data is less available, as opposed to the impetus for stronger regulatory systems, where that impetus is coming from the trade side, where data is much more readily available? Should we be considering looking at how to gather much better data on the public health consequences of food safety? And this is to everyone, all of the panelists.
I don't know if I have the answer. I think that is a challenge for this. But let's start from the example that was given on pasteurization of milk. Even if I am a local artisanal producer, this is really 2 centuries old technology, pasteurization. I think that nobody should think that they can really do business, make a profit without pasteurization. People have to be aware that lack of pasteurization kills. So that is why it's so important to have the final endpoint very clear. Now, if we have that for this local small producer, clear, how do we motivate that to happen? Might or might not be international trade, as in the example of Colombia. Some of them can join the international trade chain if they improve their capacities. But the local capacity of having a product that is safe is something that could be enhanced. Local certification of products, for example, if you have a seal of approval. I know the experience that we tried to push several times in the case of Mexico on lead-free pottery. Pottery is made at homes by local crafts. The problem is that some of that has lead that, because of the low temperature, it eventually goes into the food. So how do you know, if you go to the market and buy one of these products, that your product is lead-free? Well, you can put a seal in that product for the local commerce, for the local sale, and people to be aware that they are buying something that is healthy and is not going to produce them any harm. So I do think that we have to the commerce can be a leverage even at the national local level, if it is related also to the public health outcome. And certainly, and to increase the capacity of these regulated entities to become part of the formal economy. And I think being on the side of the formal economy is never the healthiest part, or the strongest part for their future. So those are some answers that I might have.
Anybody else want to weigh in? Barb?
Well, I wanted to address your comment about how to gather better data about public health consequences. And before I do that, I did want to comment kind of on the informal markets. And I think one of the challenges that we face, in my experience, and I'm just starting my initiatives in the international arena, but even I see a lot of parallels with things that happen in the U.S. as well. But a lot of times the producers don't know that they're not doing things correctly. And so that's where training is really important. So the thing that comes to mind in Ethiopia, to the pasteurized milk, they store the milk in these, they're not gourds, but they're containers. And there's a video of this woman who was smoking the inside of the container over and over again to make it safe. And after she had gone through all of this, she took it and turned it upside down in the dirt. And, she had gone to a lot of effort, but didn't realize, I didn't speak to her, I'm just watching a video, but it occurs to me that why would somebody go to all that effort? Clearly she wanted to make the container safer, but then she turned it upside down in the dirt. And I had a similar experience here in the U.S. I was involved in a panel or a project around irrigation water, and I was in a listening session, and there was a guy we were asking these smaller producers, where do you get your irrigation water? Do you test it? This guy from Southeast Ohio, he's like, oh, yes, I use a pond on my property for irrigation water. It's my family's drinking water. Okay, do you test it? Yes, I test it 4 times a year. Great. How do you test it? Well, I take a sample, I heat it up, and then I send it to the lab. And then he very proudly told us that he had never gotten a positive sample. Now, clearly he was concerned about food safety. And we said, well, why do you heat it up? Somebody told me that's what I should do. So I think that there is the opportunity, and that's why we need to have training. And there's these people are doing these things, and it gets passed down, and they don't necessarily know why. And I think that there's a lot of well-intentioned people. On the term of better data about public health consequences, I think that there is a lot of information out there that we could start to leverage. So in Ethiopia, we went to a hospital clinical laboratory, and they have like 10 years of data on their positive salmonella tests. It's all on paper, but they have it and they're willing to share it with us. And so I'm probably going to get a student who's going to go through and enter that data in, and it's limited. They don't test everything for salmonella, but I can at least start to see if there's seasonal trends or different trends, and it'll give me ideas of where to go forward from there. So I think that, if you look around, there are pockets of data. We need to be accepting of the fact that they're very limited, and as a statistician, I don't like to use data for purposes it wasn't intended for, but it's better than no evidence at all.
Mikhail, I think you're up next.
Yes, thank you very much. Well, this is a question for Mac first. I want to tell you thank you for your comments about the Mexican experience, and it's great to say hello. Mac, after your intervention in Africa in order to harmonize the authorizations of vaccines, what kind of data do you have? Could you say that you reduced or you helped to reduce authorization times from one point to another? I saw your chart, but with the actual data, how many time have you decreased when you started to talk with the authorities and you started to work on this agenda of harmonization? Could you say that today the average citizen in Africa has a wider access to vaccines or to medicines with the data that you have?
Yeah, Mikhail, I'm happy to address that. And I think it goes to the question, or at least the comments that were made a few minutes ago about the value of PQ and building up the capacity within people's own governments. And I think the reality is one size clearly does not fit all. And I would say when you look at the countries that have been talking around the table today, Colombia, India, Mexico, these are countries that don't rely on PQ. These are countries that are at a very different place in their development and in their commitment to regulatory optimization. And, there has been a tremendous improvement when you go back and look at the percentage of agencies that are now at the level 3 compared to what they had been historically. And even at the end of last year, Tanzania became the first African agency to be assessed by WHO as a level 3. So there is a lot of improvement in individual agencies, but there are still almost half of the member states who are at a rudimentary level. And those are the ones that we focus on. And these are ones that, quite realistically, while in a perfect world, yes, each agency would become a little US FDA, but is that really realistic? And is that really what is necessary? And I think people are rightfully saying there are other models that can be used. And we go back to what happened in Europe with the regionalization. So we have been, along with others, funding the regionalization initiatives in Africa with the idea if you had 8 regional procedures as opposed to 56 individual national procedures, this is something that is much more manageable and where you're pooling expertise and you're pooling resources. And to answer your question, some of these non-PQ, like some of the cancer products that are now going through the East African regional approach, they have cut their authorization time down from 2 to 3 years to between 9 and 10 months. And even more impressive, I think, are those products that are eligible for PQ, and they get PQ listed, and then they go through the collaborative procedure. And for these 36 countries that are these level 1, early level 2 countries for the most part, who are part of that system, in the past, it would take between 2 and 3 years to get those registered after the dossier was submitted. And often there was a 3 to 4 year gap before the dossier was even submitted because the industry was not interested in those countries. And they were the last of the last of the last to actually get the dossier. But going through this collaborative process, now there have been over 400 medicines that have gone through it. This represented about 275 different APIs. And the median time for approval is 85 days. And that has been, the goal is 90 days. And clearly we all know a median means that half of them are not meeting the 90-day goal, but half of them are meeting the 90-day goal. And there are only a couple that are the outliers that we're working with to try to figure out why they can't meet the 90-day goal. So indeed, these different modalities of regionalization and of, for these really, for these agencies that are very rudimentary, figuring out how they can, in the interim, become part of the global regulatory ecosystem and do what they need to do for their citizens by being part of that ecosystem. And those are the kinds of things that we and WHO are working on, because WHO, even though they are PQ, they are also the regulatory system strengthening people who are working with these regional approaches in the Caribbean and in Africa. And they're the ones that are working with the collaborative procedure. So, it's in their own way, they are, again, going back, they're part of the entire regulatory ecosystem here, and trying to realize one modality clearly does not fit all.
Great. I think, Julie, you've got the last flag up.
So my question relates to a lot of the conversation here and this term we were working with the ecosystem for regulation, and that would be the ecosystem on the drug side and then the ecosystem on the food side, so different ecosystems. And I was struck, and this also happened in our meeting in Costa Rica when we had regulators from several countries. They were talking often about different sort of consortia or groups that they had formed to move forward with regulation. And for the Colombian example, you were talking about the Pacific Alliance being very important to this happening. In Vietnam, it was the ASEAN connection is important. It seems like between this very high level WHO sort of global ecosystem that there's a vast number of regional and sub-regional consortia that are working on coordinating drug policy or food policy. My questions are, how would you recommend that this committee best get a grasp on what's all in that ecosystem at the global level and all these subnational areas? And then do you have thoughts about how the formation of those consortia or groupings might be regularized going forward or rationalized going forward so that we get the most progress and towards improvement in regulatory quality.
Who wants to lead off? Javier?
I can make some comments. I think the key to regional decisions is the political buy-in. So if it is a bottom-up approach, it's just not gonna work. Like normally, whenever there is some regulatory expertise, there is this tendency to say, well, I still want to regulate my market, and I still want to have this ability to decide on what's in, what's out, and the level, because the level is somehow there to, if you have an industry, to protect it. So if you don't have the political buy-in from day one, the clusters, the discussions are just academic in nature, and we were part of a lot of those discussions and I could just give you a list of the consortia that we've been part of that have not been useful at all. The Pacific Alliance is different because of that, and I think the idea in Africa about going with the African Union and going with the RECs is a step in the right direction. It has to be, an economic bloc, and that is why you just go with the political decision on that goes beyond regulation. Is more about trade and having a single market, or integrating with markets that are interesting. Like, the Pacific Alliance is not a region, and it's not, neighboring countries. It's just like-minded countries. And in that regard, I think Africa is an interesting initiative. When and going to what we just heard Mark just said about the Europeans. I remember when we asked the Europeans at some point, like, how could you do it? How long does it take? How could we get it done? It looks so beautiful. And they said, it took us 25 years. And it took us 25 years, and they already had the capacity. I guess you can leapfrog, because if you don't have the capacity and you desperately need the capacity, it might be shorter. But it's not an easy thing, I guess, because you're giving up a right and a responsibility and power when you decide to go regional. And I think the analogy is when you adopt the dollar as your national currency. It brings a lot of benefits, and you get rid of a lot of decisions, and you have stability. But a lot of countries don't want to do that. So again, I think my point is, look for the economic initiatives of getting integrating markets or economic in nature rather than any other, which we were part of but didn't work at all. The other point, and I just want to make a small comment on whether it's public health consequences or whether it's trade. And I think it's all about being opportunistic, whatever it is there in terms of the window of opportunity. I don't think we should be choosers. I think it's just about the end goal, and then how you get there is seizing that window of opportunity. The problem with the trade is, if you do not have free trade agreements, if you do not have manufacturers interested in exporting, what you end up is just opening the door to imports. And then you have what the Europeans say is a dual system, in a very polite manner to say, the standards are not the same. So we have one standard for when you export, you have one standard when you consume locally, and in all the low and middle income countries, a big challenge is the informal sector. And we regulators, or the regulators, have tried to regulate, but that is not enough. The regulators need to handhold and create capacity and take the manufacturers and the private sector along the way, because otherwise there's just no way. And you know, it was, and this is a very kind of like sad analogy, but when we did try to go down that path of, you know, engaging the private sector, training the private sector, engaging with them in a very constructive manner rather than just shutting down facilities. And I remember, you know, a small producer of guava manufactured desserts, which are very famous in Colombia, by the way. And they were very, very concerned about the regulatory agency. They just basically hated the regulatory agency. And when we got there for the first time, they said, you know, the way we behave with you is exactly the same way as we used to behave when the guerrillas came. We would just get in, close our doors, and we wouldn't go and talk to anybody because we knew why you were coming. And the analogy is sad because it's not about, I mean, in their mind, it's not about increasing the standards for the sake of health or for the sake of the Colombian population overall. Is you coming to close us down. And that's what we did, actually. So they were right to some extent. But I guess the point is, it cannot just be about sticks. Carrots need to be included. And in our countries, lowering the barriers to entry is just important. Having access to the information, getting rid of the middlemen in terms of approaching the regulators, having a transparent and a productive, engaging communication with the small firms, with the entrepreneurs, you know, reaching out to, I mean, not considering them as, you know, people who do not want to comply and we want to basically close them down. No, it just sometimes, often, it's just barriers to entry are too high. So how do we decrease barriers to entry to formalize what they do?
Yes. I want to address this. I am a professor of global health, and it's interesting. My global health career started because of NAFTA, and I had to be part of the negotiations and the discussions around the environmental standards and the decisions on how to deal with that, and the North American cooperation process that followed the NAFTA agreement. So it's interesting. Before NAFTA, in the case of Mexico, Mexico entered the GATT agreement, and that generated the need for Mexico to develop a law on how to do standard setting. So yes, international trade, in my personal experience, has generated benefits in terms of people learning how to do trade, how to do regulations, and how to cooperate on that. And we saw that in the TPP discussions as well, in the Trans-Pacific Partnership discussions and all that. We saw that. But one thing that we have to acknowledge is not every country is democratic, and not every country is for trade, for international trade. So that is something that we have to acknowledge when we. So not everybody has the same passion or the same willing, and we have. That's a reality of all the countries, and we have to work with those constraints, and that is when we really have to be creative on what is the regulatory mix that we are going to choose on how, when we confront a risk, how we are going to manage it. Because some of them will really be responsive to trade, others not. Others will be responsive to other things. One concern that I have in terms of sub-regional arrangements is that they are political arrangements. And if political arrangements change, they will they will change in the environment. Think about UNASUR in the case of in Latin America. It's just disappeared because of the lack of agreement, and now we have a different process. And so regional agreements are transitory agreements that might be useful for a time, and we have to be careful in how much we can use that. Now we have to be aware again that as much benefit we can bring of those processes to the local market and to the local population is something that we is part of the stewardship role of our agencies.
Great. I'd like to pose the last question to Wee Hong. You've been here, shared your experience that Abbott has had in working in Vietnam to strengthen the regulatory system on both the food and the drug side. What messages do you think would encourage investment, further investment in the region, not just in Vietnam, but in the region, in the food and drug regulatory systems?
Thank you, Madam Chair. I think for the regulatory system, it's a very political influence. So, as we know that globalization and the international trade have a big impact for the many reasons. So, it is a good opportunity for us to work with the secretary in the country who participate in the WTO and the free trade agreement, that now we push them to apply the international standard. Especially for the country who look for export the product, like for the Colombia case or in Vietnam case, so that that provide a very good chance for influence the government to apply the good standard and the good international best practice. What we learn is the first, we should work together with the local industry, so to get the alignment. And secondly, we not only working with the health ministry, we have to work with other ministry, especially Ministry of Trade and the government office, and we set up a common goal is to improve the public health and also improve the economic public health. So that once we set up the common goal, it would be very easier for us to talk with the regulator, and also we can set up the good roadmap. And also I think it's very key thing is how we share the good practice with the government. That we need to take the media as a strong tool, because when if the media have talks, that is very high influence for the politician to listen to the comment, and they can easily to change. Otherwise, without the media, it's like a closed room, and we have to change. But when the public have the voice, so it opens the gate, and we can look for much better improvement. Yeah.
Thank you very much. And I'd like to thank all of the speakers for your comments this morning, for participating in this panel discussion this afternoon. Mac, you get a special award for staying with us way past dinner time in London. And at this point, join me in thanking all of our speakers and those who are with us in present right now, as well as those that had to leave earlier. So thank you all. And at the end of this, we will be adjourning for a 15-minute break. So thank you.
Thank you.